I am Reuben Joseril S. Rivera, and you are Mr. Jeremiah Rivera, right?
Yes.
Okay, today we're gonna do the assessment of temperature, and this is important so we can check the status of your temperature. Then you can cooperate with me by listening to what I'm saying and doing it. After saying that, I will clean my hands. After cleaning my hands, I will now put on the gloves. Gloves is important for rectal temperature check. Okay. After putting my gloves, I will now provide the patient some privacy. After providing my patient some privacy, I will now place the patient onto the bed and then ask the patient to do the same lateral position and assisting him. Please lie on your chest and please bend your knees. Once the patient is on the bed and doing the same lateral position, I will now get the thermometer, and then before putting it onto the rectum, I will lubricate it first. Once I lubricated the thermometer, I can now put it onto the rectum. And then once I put the thermometer, I will wait for appropriate amount of time for the thermometer to indicate the temperature. And once the temperature is indicated onto the thermometer, I can now remove the thermometer and read the temperature. If the temperature is obviously too high or too low, I will check if the thermometer is working properly. And if that's not the case, I can now clean the thermometer from probe down to its bottom. And then once I have cleaned the thermometer, I can now put the patient's temperature onto the chart. Hey, I am Reuben Joseril S. Rivera, and you are Mr. Jeremiah Rivera, right?
Yes.
Okay, today we're gonna assess your pulse. And the importance of this assessment is to know if your heart is working well. You can cooperate with me by listening to what I'm saying and doing what I'm gonna say. Okay, after saying that, I will now clean my hands. After cleaning my hands, I can provide the patient some privacy. After providing the patient some privacy, I will choose which pulse I'm gonna assess. There, I'm gonna assess the radial pulse. After choosing the pulse site, I'm gonna assist the patient to sit down onto the chair. Please sit down onto the chair. Once the patient is sitting down, I'm gonna palpate and count the pulse. I'm gonna place 2 or 3 fingers, but now I'm gonna place 3 fingers. The index, the middle, and the ring finger. Okay, and I'm gonna place it lightly over the pulse point. And I'm gonna assess the rhythm and volume. After assessing the patient's pulse, I will document it and put it onto the chart. I am Ruben Jezreel S. Rivera, and you are Mr. Jeremiah Rivera, right?
Yes.
Today we're gonna do the apical pulse assessment, and this assessment is important to know if your heart is working well. And you can cooperate with me by listening to what I'm saying and doing what I'm gonna say. After saying that, I will now clean my hands. After cleaning my hands, I'm gonna provide the patient some privacy. After providing the patient some privacy, I will assist the patient on a comfortable position. You can do a supine position or sitting position. There we're gonna do the sitting position. So please sit down onto the chair. Once the patient is sitting down comfortably onto the chair, I'm gonna locate the apex or the apical pulse point. Once I have located the apical pulse point, I'm gonna warm the diaphragm of the stethoscope before oscillating. Then, once the diaphragm is warmed up, I'm gonna oscillate and count the heartbeat in 1 full minute. After listening it to a 1 full minute, I'm gonna assess the rhythm and the strength of the heartbeat. And then once I have assessed it, I'm gonna document it and put it on the chart. I am Ruben Jezreel S. Rivera, and you are Mr. Jeremiah Rivera, right?
Yes.
Hey, prior to the assessment that I'm gonna do, I'm not gonna let the patient be aware of the counting of his respiratory rate, because if the patient is aware that I am counting his respiratory rate, he might purposely alter his respiratory pattern. So, after saying that, I'm gonna clean my hands. After cleaning my hands, I can now provide the patient some privacy. After providing the patient some privacy, I will now count the patient respiratory rate. And a wristwatch is handy at a time like this. So I'm gonna count the respiratory rate in 1 full minute. Okay, after uh, observing the patient's respiratory rate, uh, I observe the depth, the rhythm, and the character of the respiration. And after once I've done that, I'm gonna put it onto the client's chart. I am Reuben Jesril S. Rivera, and you are Mr. Jeremiah Rivera, right?
Yes.
Okay, before we begin the assessment, I'm gonna make sure that I have my stethoscope and the sphygmomanometer. They were gonna do the assessment of your blood pressure. This is important to know the status of your blood pressure, and uh, and you can cooperate with me by doing what I'm saying and listening to it. Okay, after saying that, I'm gonna perform sanitizing of my hand. Once I have sanitized my hands, uh, I'm gonna provide the patient some privacy. Once the patient has privacy, I'm gonna assist the patient to lie down on a comfortable position, either lying down or sitting position. So today we're gonna do the sitting position. So please sit onto the chair and with the palms facing upwards. Okay. Once the patient has done that, I'm gonna expose the upper arm. Once the upper arm has been exposed, I'm gonna locate the brachial artery, and I'm gonna apply the center of the bladder directly over the artery. Okay, once I have applied the center of the bladder to the artery, I'm gonna wrap around the cuff, the upper arm, approximately midway or 1 inch above the antecubical space. And once I have done that, I'm gonna insert the earpiece of the stethoscope. Then I'm gonna place the diaphragm of the stethoscope over the brachial artery, and then hold the bell between my thumb and index finger. And once I'm done doing this, I'm gonna hold the other rubber bulb with palm of the other hand, and then the thumb screw between the thumb and my fingers. Then once I am holding the rubber bulb, I'm gonna pump the cuff quickly to inflate it above the needle rises to 20 to 30 millimeter of mercury. Okay. Once I have done that, I'm gonna release the bulb slowly and carefully. Okay. Once I release the bulb, as the pressure falls, I'm gonna identify the reading of the Korotkov phases, the 1, 4, and 5. And I'm gonna deflate the cuff rapidly and completely. Once I have deflated the cuff completely, I'm gonna remove the sphygmomanometer. So if in doubt of my reading, I'm gonna wait 1 or 2 minutes to do my reading again for the circulation of blood pressure to be maintained again. Okay, but I don't have that issue, so once I have done removing the cuff, I'm gonna clean the earpiece of my stethoscope and then perform again a hand washing. Once I have cleaned the earpiece, I'm gonna do my hand washing. Once I'm done with my hand washing, I will document the blood pressure onto the client's chart.